orky actually refers to your testicles.
Oh!
Auto-Brewery Syndrome, walking corpse diagnosis, and a condition called Dysdiadochokinesia that even medical students struggle to pronounce. Today, we're putting your brain to the test. I'm going to give you and my wife, Jen, a series of medical terms. Some are real diagnoses doctors actually see in hospitals. Others are completely fake, and I made them up. Your job is to decide. Let's see if you're smarter than an ER doctor. You ready for the first term?
Yes.
Auto-Brewery Syndrome.
This is a weird one. At a glance, it sounds fake. I have to say and admit that I have Googled this before because I actually thought that I had it, but I don't always have the best reaction to alcohol.
Right.
So I'm gonna go with it's a real medical condition. Locking in my answer.
And you are correct. It is real, but it's very interesting. It's not from drinking. It's actually somebody who doesn't drink alcohol.
Oh.
Well, can we get one thing straight? I have not been drinking.
And basically you're putting in carbohydrates into your stomach, and there's a specific overgrowth of yeast in your stomach, and it actually converts the carbohydrates into ethanol. So you're getting drunk without even drinking.
Have you actually seen this in the hospital?
I have. Usually a family member will bring them in, and then we take an alcohol level, and their alcohol level is elevated. And you're like, you're drinking, you're lying to us. Next term, orchectomy. Jen, what do you think? Real or fake?
I feel like medicine is a lot about weird Latin root words.
Yeah.
I'm gonna go with real medical condition.
Okay. It actually is real.
Is it?
Yes, but it's kind of weird. So an ectomy usually means like removal of, and then orchi actually refers to your testicles.
Oh! So wait, you're removing your what now? Why?
A testicle. Could be cancerous, could be you had testicular torsion and the testicle died, so you need to remove it before it rots inside.
As they say in medicine, time is testicle.
Time is testicle. Term number 3, pancake lung.
Sounds oddly familiar, but I remember a few years ago there was this pre-pandemic thing going around, at least in the news, where everybody was worried about popcorn lung.
Yes, from vaping.
From vaping, and it was an insert from the flavor or something. I'm gonna go with fake medical condition, locking in my answer because I think it was popcorn lung.
No, you're correct. There's no such thing as pancake lung.
Okay.
But there are other weird terms related to lungs, like if your alveoli aren't open enough, it's called atelectasis. You can have pulmonary fibrosis, which is like tightening and extra tissue within the lungs. Next term, number 4, exploding head syndrome. Like,
I bet if you got into a car accident
right.
or trauma,
Right.
that could be a serious situation. I don't feel that they would add syndrome. Fake.
So it's basically parasomnia. So you get an electric or like a loud noise that you like having to do with like sleep disturbance.
Oh, it's real.
It's real, but it's not painful. And I don't know if any of you have it out there. Let us know in the comments. But it's not something I typically come across in the emergency department.
Put 1 point in the wrong.
There you go. It's okay. Next term. Okay. Ooh, you should get this one. Tympanoplasty.
Oh, I've heard this phrase before. Tympanομembrane, ear.
Yeah.
Final answer, real.
Yeah, nice. It is real. And tympanoplasty is when you make a new eardrum.
Did somebody I know have that? That's why I've heard of it before.
I had a tympanoplasty done when I was 20 years old, and it's still working. And that's because I had a ruptured eardrum, and the eardrum never healed, so we made a fake one with my fascia.
He likes to use it as an excuse when he ignores me.
What'd you say?
Exactly.
All right, next one. Acute dermal echo syndrome.
Let's break this down for a second. Acute means fast, like it just happened in ER talk. Dermal, skin, dermatologist.
I mean, we use echo like...
Echocardia.
Oh, good echocardiograms.
Yeah, I was getting there.
Yeah. That means ultrasound of the heart.
I'm gonna go with fake.
It is fake. It's no
Okay,
such thing.
I'm like, it's just too many words
A lot of words.
put
I
together.
know. You have dermatitis.
Acute dermatitis.
Right, so that's inflammation of your skin. It's a non-specific term we use all the time. You can have urticaria, which is hives, cellulitis.
That one definitely sounded real with the words they use, but they're all mushed together too much.
The next one, you ready? Walking corpse syndrome. Your face.
I mean, I've seen a few of those. I want to say fake, but I'm just gonna like go with real.
Oh, it is real. But it's like a delusion. It's a psychiatric condition where the person thinks they're actually dead. Usually like accompanied with like severe depression, psychosis, neurologic diseases.
Have you ever had to diagnose that?
I have not. All right, next term. You ready? Dysdiadochokinesia.
Sounds real just based on the sheer complexity of it.
Okay.
Because it sounds like you're like, hey, doctor, I have a swollen lymph node. They're like, oh, that's... I can't even repeat it, so just based on that fact alone, I'm going to go with real.
Oh, it is real, but it's like a finding. So dysdiadochokinesia, we actually have people when we want to check their cerebellar function, we put their hands on their laps and they have to move their hands back and forth. And if you can't do it, you have dysdiadochokinesia. Your balance center of your brain is all messed up. All right, next one. Idiopathic orbital paralysis.
Those are 3 very medical words.
They are.
I know all of them individually. I just don't know if together they make up something.
I don't know why your eye can't move.
Yes.
Okay.
It just sounds so good that I want to say it's fake.
So it is fake.
Oh.
It is fake. Good terms. The terms are real.
I know. It feels like too good to be true.
So we do have things where like your eyelid's not working, eyebrows not working, maybe 1 or 2 of your eye muscles aren't working. So you can have a palsy versus a paralysis.
You don't use paralysis when it comes to the eye?
No, you have like paralysis of certain muscles.
Okay,
Yeah.
well, got it.
There you
I don't
go.
care how I got it. Maybe it's just intuition.
Boom. All right, next term, Synaptogia.
Kind of leans medical, right? If you can't pronounce it, then clearly a doctor is going to use it. I just don't like the word. I don't like saying it, so I'm going to say you're fake to me.
It's fake.
Is it?
Yes, there's no such thing as synaptogia. Like your synapses aren't working. No, there's other like medical terms for neurology, like findings, but not your synapses. You can have like neuralgia, or neuropraxy, or neuropathy. You're doing good. You're
A
not
brain
getting duped
doctor.
yet. Yeah, there we go. All right, next one. Blueberry toe syndrome.
This feels like the obvious sounds. It sounds fake. Maybe your toe fell off. Real.
Ooh, it is real.
Real?
Typically, we call it blue toe syndrome.
Oh, you dropped the berry.
Yeah.
Berries and cream, berries and cream. I'm a little lad who loves berries and cream.
But it's usually due to either sometimes you can have like a cholesterol embolization or like blocking a blood vessel, or you can just have like blood vessels that get blocked for some reason down in the toes and your toes turn blue.
Oh,
Yeah,
so
because you're not getting perfusion.
oxygen.
Yeah.
When your toe turns blueberry-esque, what do you do?
You're gonna get to the hospital and come to us, and we're gonna do some probably angiograms and see if there's blockages, and then we'll try to even warm them up, elevate your feet, see if there's like an underlying reason why. Do we give you medications to break up blood clots if we have to, like heparin or thrombolytic type medications? So it just all depends. All right, next term, Hematochezia.
My patient had hematochezia. I've heard that phrase before.
Ooh, heme is blood.
Yeah, I don't know. It sounds real. I don't feel like I've ever heard chezia used with other words in medicine. This is probably one of the harder ones. Yes.
It is real.
Real.
Yes.
Wow.
Bloody poop. Bright red blood. Bright red blood
Bloody
in the
poop
is
is what?
hematochezia. Because then we have hemoptysis, which is bloody coughing. Hematemesis is bloody vomit. Hematochezia.
I would ask if you've had it before, but I don't really want to know.
No.
No, anybody else.
Oh, thanks for asking. All right, next one. Purple urine bag syndrome.
That seems like a serious situation. It sounds completely fake.
But-
I'm gonna go with real because it just sounds like somebody describing what they saw.
Real. It is real. So when people get catheterized, like we have to get a Foley catheter or tube into the bladder, sometimes there's bacteria that will metabolize certain proteins, basically, which then can turn a purplish color. All right, next one. Sudden skeleton syndrome.
Like rigor mortis?
No, like
They died?
imaging. Like the imaging results showed sudden skeleton syndrome.
Sounds like if somebody died unexpectedly or a bone went through the skin. I don't know. I could see different applications for this. I'm gonna go with fake.
It is fake.
I liked your try though. You really tried to sell me on it. You're like, yeah.
We have
This...
other things with weird names.
Did you guys get that one?
All right, and the last medical term, priapism.
I happen to know about this one. He has told me that he has seen this more times than he can count.
Anybody would want.
Yeah, it can be caused by medications. It can be caused by sexual injury. It's where you can't get rid of
The direction.
Okay, so what happens if you have it lasting 4 hours or longer?
The concern is that the blood that's in there causing this phallus to be very firm and hard, that it will actually start becoming tissue. The medical term, fibrosis, will occur, and then you may permanently have erectile dysfunction. That was fun. If you guys have any fun medical terms that you want us to include on another episode of this, let us know in the comments. As always, do me a favor, check out this playlist right here, binge watch as much as you can, and definitely subscribe, turn on your bell notifications, and hit that like button for us. Thank you so much for watching.
And stay healthy, my friends.